All right, hello everyone. I'm Dr. Rachel Coleman, and I'm going to be talking to you about non-hormone therapy options. We are almost right at 7 o'clock, and we had said this would be 6 to 7, so we understand if people have to get off of the webinar, and we'll be recording it. You'll have access if you're not able to stay to the end. But hopefully you have a little extra time, and we're going to talk about non-hormone therapy. So this is a huge topic and I essentially don't have any time. So we're going to have a very brief overview of things. And this is something that if you come see us for a visit, we will kind of take a deep dive into all these categories and go much more in depth. So if you're, left wanting more information, give us a call, schedule a visit. So why would you need alternatives to hormone therapy? We heard about how it can be amazing, but we also heard from Dr. BM that there are some women who have contraindications to hormone therapy where it's not an option for them. There's also some women who don't tolerate menopausal hormone therapy. Now, if you fall into this category and you've only tried a couple of different options, I would encourage you to schedule a visit with a doctor to discuss if there might be other formulations like we heard about that might work better for you. But in the last categories where I think this really applies to everybody is that you're going to want additional supports from a lifestyle perspective to help maximize the effects of your menopausal hormone therapy. So this is our lifestyle medicine approach to menopause. The 6 pillars of lifestyle medicine are listed here, and I'm going to go through them each one by one and kind of give you a brief overview of changes you could consider making to help reduce symptoms of menopause and help you, feel better overall. So first category is nutrition. Again, we could spend hours talking about the different ways that you could change your diet, but we're going to kind of go through a brief overview. So what we are going to recommend to you is a whole food, plant predominant diet. And the reason for that is that it's what has the most evidence behind it in terms of longevity and health span. And in particular, for women going through menopause, it has been shown to reduce menopausal symptoms, including vasomotor symptoms. And in addition, we know that this type of diet is going to improve your cardiovascular health, which we've heard can be affected by menopause. It's going to improve your bone density, and it's going to improve your cognitive function. So wins all around. One example of a whole food plant predominant diet that has a lot of good research behind it is a Mediterranean diet. Um, and this is what the European Menopause and Andropause Society supports for its benefits on menopausal health. And this does allow for some animal proteins in the diet, but as it's meant to be executed, it really has more limited animal proteins and is really plant predominant. So that means that essentially at least 50% of your diet is plants. Within that diet structure, some foods that you want to focus on would be soy products and other phytoestrogens. So these are foods that are going to have an estrogenic effect in your body that will help reduce your menopausal symptoms. So what foods fall into these categories? Well, soy products, so soy milk, soybeans, tempeh, tofu. Other categories would be flax seeds, legumes, whole grains, and then lots of fruits and vegetables. These foods also have the benefit of being anti-inflammatory foods, which is super helpful because we've heard that in menopause, inflammation can tend to increase. We'll talk to women about increasing protein-rich foods in their diet because those have also been shown to delay the onset of menopausal symptoms and reduce the severity of menopausal symptoms. Now, if you're like me and you spend time on social media and you're in midlife, you're going to be targeted by reels that make you feel like you need to have like 300 grams of protein a day. Otherwise, you might die. So things get a bit exaggerated. But in general, when I see women going through menopause, they do need to work at increasing their protein. And a good target to start with, if you're kind of below where you need to be, is 20 to 30 grams of protein per meal. We'll also talk to you about vitamins and minerals that are important to focus on during this phase of life. Ideally, you get these through your food because that's how your body absorbs them the best. So these are things like vitamin D, calcium, magnesium, and B vitamins. If you're not able to get enough of these in your diet, then we might talk to you about ways to get these through supplements. But in general, there's tons of supplements that are targeted to women in general, most of which don't have a ton of good evidence, and they tend to be very expensive. So really focusing on food is going to be the best bang for your buck. We're going to talk about avoiding certain foods. Unfortunately, some foods that were really quite delicious. So foods that are high in sugar or high in fat are not going to be your friend through the menopause transition because they're going to worsen all those symptoms that we've talked about. Ultra processed foods fall into that same category. So we're going to talk to you about ways that you can try to minimize those. Exercise, the next big category. So again, so much that we could talk about. So this is going to be very brief. But there's so much data showing the benefits of exercise in improving the menopause transition, and just improving longevity and health span in general for everybody. So targets you're going to set for yourself, if you're not here already, are resistance training. So these are things, exercises that help make you stronger, performed at least 3 times per week is the goal. I find it easiest to do this through lifting weights because it's so much easier, I think, to see the progress that you're making because you gradually are lifting heavier things. But there are other ways that you can do this. And resistance training has been shown to improve mood, improve energy, decrease your risk of cardiovascular disease, diabetes, dementia, cancer, musculoskeletal problems, and premature death. So just a few helpful things. We're also going to talk to you about physical exercise. This can be either moderate intensity exercise or it can be high intensity. If you're moderate intensity, your goal is 150 to 300 minutes per week. If you're high intensity, then you can have it more like 75 to 150. I think it's good to get a mix of both, but you don't need a whole lot of high intensity exercise to get good benefits from it. So if you don't enjoy those kind of workouts, you can do just a few minutes per week, really. Mind body exercises like Tai Chi, yoga, Pilates have been shown to have good benefits on menopausal symptoms. And what we would recommend is a combination of all of these exercises. So ideally, you're meeting all of these targets, and that's where you're going to get the biggest benefits. Why do we want to focus on this? Really, as we heard earlier, if you're not using it, you're losing it. Starting at age 30, if you're not doing anything to stop loss of muscle mass, you're going to lose 2 to 5% of muscle mass per year. And we've heard how that then impacts our metabolism in negative ways. Women get huge benefits from exercise even at the 140-minute mark, so you don't have to get to those very high levels. They've also shown that you can do what are called exercise snacks of 5 minutes, and you can count those towards your weekly goal. So if that seems more doable for you, that can still be super helpful. Resistance training, basically it shows that it increases our muscle strength and our mass, and the aerobic exercises help us decrease fat, especially visceral fat. So you want those in combination. And you also, as you're getting older, want to make sure you're doing balance and mobility to make sure you limit the risk of injury. Sleep. We're all getting plenty of sleep, right? This is not an issue for any women out there. The goal is 7 to 9 hours per night. That if you're far below that, again, progress, not perfection. And sleep is something that's often impacted through perimenopause and menopause. So if you're having trouble with it, you want to get a good evaluation. It could just be related to perimenopause, but there's lots of other things that cause you to have trouble sleeping. So you want to make sure that you don't have other things going on like sleep apnea or restless leg syndrome. This is a clinical diagnosis for insomnia, and the definition is 3 months, greater than 3 months for at least 3 nights a week. So if you meet that criteria and you've been evaluated and you don't have other problems that are causing it, the gold standard for treating that is cognitive behavioral therapy for insomnia. Even if the cause of your sleep problems is related to vasomotor symptoms, CBTI can still be super helpful for reducing your symptoms. And the really nice thing is there's now lots of online CBTI options you can find. So a few apps out there are called iRest, CBTI Coach, and Insomnia Coach. and those can kind of talk you through what you need to do to get CBTI treatment for yourself. Physical exercise, again, it not only has all those other benefits we talked about, but if you are exercising more, it can actually help you sleep better. Mindfulness and relaxation techniques can help you get better sleep as well. And our goal for women is that their daytime function is adequate. We're not trying to make people necessarily gold medal sleepers. You're just trying to be able to do what you need to do, and hopefully get much better than you are if you're struggling. Stress management. Super easy category. This is easy for everyone to master, no problem. This is the list of different interventions you can try to help manage your stress. And again, if you're better able to manage your stress, your menopausal symptoms will tend to be better managed. So mindfulness-based interventions like mindfulness-based stress reduction have been shown to reduce stress, anxiety, and depressive symptoms in menopausal women. Cognitive behavioral therapy has those same benefits. Again, physical activity. More physically active women have been shown to have better stress management. And I know that that's true for me. If I'm not getting enough activity through the week, nobody wants to be around me. Again, mind-body exercises like yoga and Tai Chi can help in this area. Another one that actually has a lot of good data behind it, but I don't hear talked about as much, is hypnosis. And this is something you can do as self-hypnosis. There's options online to help you with that, or you can seek out a provider that can take you through this. And this has been shown to reduce menopausal symptoms, reduce vasomotor symptoms, and help improve management of chronic disease. Social connections. This is an area that I find women will sometimes neglect in midlife because we have lots of other demands on us, but we neglect it to our detriment. Because again, this is a pillar of lifestyle medicine that I think is even more important to pay attention to as you go through menopause, because women who have excellent social connections have a decrease in menopausal symptoms. They've been shown to have higher physical activity levels, which again ties back into all the benefits of that. Improved mental health and improved overall well-being and resilience. We'll kind of do a quick overview of non-hormonal medications that you can consider. Again, this would be kind of its own talk, so we kind of can't get too deep into it, but SSRIs, which are used for anxiety and depression, have also been shown to reduce vasomotor symptoms for women. Paroxetine is FDA approved. Escitalopram has been shown to have good evidence that it's helpful. Another category of antidepressants is called SNRIs, like venlafaxine and desvenlafaxine, and those have also been shown to reduce vasomotor symptoms. Gabapentin is another option. Neurokinin receptor antagonists, this is a new category, and currently these medications are pretty expensive because they're not generics, but hopefully that will change in the future. And by blocking these receptors, these drugs reduce the activity of candy neurons in the brain's hypothalamus. They're called candy neurons. It sounds like they should be a good thing, but they're not for women in menopause because they're responsible for triggering hot flashes. So blocking that receptor helps reduce hot flashes for women. Over-the-counter options, I listed, these are all things that I found in terms of reading that have been studied. In general, they don't have a ton of good evidence. And again, supplements tend to be expensive, so I would be cautious about those. And then finally, risky substances that we need to think about avoiding during menopause. Alcohol, unfortunately, what you could drink in your 20s and 30s, most likely you will not be able to drink in your 40s. And that's because alcohol has been shown to increase anxiety for women during menopause, increase mood swings, worsen sleep, worsens hot flashes, and it increases your risk of cancer. So it's bad all around. The WHO's basically come out saying there's no safe level of alcohol. So to feel your best as you go through this phase, you'll really want to minimize it as much as possible. I think in general, cannabis seems to be, there's this thought that like, oh, it'll help me sleep better, it'll help chill me out. So maybe that will be good during menopause, but there's not really good data. It's an area that would need more study, but Currently, it seems like the risks may outweigh the benefits. And then we all know, or hopefully we all know, that smoking is terrible for us. And all of those negative effects of smoking are then compounded during menopause because it's already a risky time for women's health. So if you are smoking, now is the time to really get help with quitting, to improve your health for the long term. And that's it.